Hi Manuela, I'm Diana, your massage therapist. How are you?
Okay.
So I see that you came in today complaining about your right hip. So what's going to happen is I'm going to be massaging the joints above and below. Above is your lower spine and below is your knee. And I'm also going to be massaging your hip. I'm going to be massaging you for approximately an hour. And we'll be performing effleurage and specific kneading. Effleurage is a basic technique, and specific kneading is a specific massage technique used for your affected area. The purpose of doing this is to allow more range of motion and also to break down scar tissue. The risk is that you are going to be feeling, is that you might feel some pain and discomfort since I'm going to be adding pressure to your affected area. The benefit is to allow more mobility of the hip and also help with your daily activities. You do have the right to stop and also modify the treatment if you're not okay with it. Also, I am going to be checking your comfort level, so please do keep in mind the pain scale of 0 to 10. 0, no pain, 10, the most extreme pain you ever felt. Once this massage is done, the treatment is done, I am going to give you some take-home exercises and will possibly refer you out. Consequences into not continuing this massage or going with it is that since you're complaining about your right hip, you're going to probably start complaining about your left hip to prevent the pain happening from right. So therefore, it's probably going to radiate. Do you have any questions?
No.
Do you have your consent?
Yes.
Okay. So before we do start the treatment, I am going to ask you to remove as much clothing as you're comfortable with, so such as like your shirt, your pants, but do leave on your boxers though. The reasoning for this is just so I can, the reasoning for asking you to remove your clothing is just so I am able to massage your affected area. By having clothing on, it is gonna kind of be hard to massage your affected area just because your clothing is gonna be on the way. And also it's gonna prevent me from probably using oil and lotion because I don't wanna get it on your clothing. Do you have any questions?
No.
Are you okay with the treatment and everything?
Yeah. Yes.
Okay, so what's going to happen is I'm going to get you to place your head up here and your feet down there. And then you're going to lay down in between the sheets. And then you're just going to cover yourself with it. So I'm just going to, before I step out of the room, when the treatment is done, I am going to offer you some help to get off the table if you need any help. When you do get up, don't get up too fast or get off the table too fast because you might feel a little dizzy. So take your time. So now I'm just going to step out of the room and you can just undress yourself and get underneath the sheets. And then when you are ready, just say ready and then we'll just get started with the treatment. Is that okay?
Yes.
Okay.